For decades, the disability rights movement has really been working towards equality for everyone with a disability, and we continue this fight on a daily basis. And then the pandemic hits.
The pandemic is taking its toll on people with disabilities on several fronts.
People with disabilities are experiencing increased barriers to care.
Many live in long-term care facilities, which are at greater risk for coronavirus deaths.
The number of in-home care workers has dropped due to illness or lack of personal protective equipment.
Families of students with disabilities say their kids are being left behind.
Working from home created opportunities for those living with disabilities.
Now is a good time to take stock of the lessons learned from the pandemic.
During COVID, what we found was that all of a sudden, there were solutions to ongoing problems within the disability community. And these solutions came about because now it was affecting everyone. But at the same time, COVID put the spotlight on ongoing issues within our community that were now exacerbated by the pandemic and the lack of access to accommodations and services. NDRN is the National Disability Rights Network, and we are a network of protection and advocacy agencies and client assistance program agencies. And we work on a daily basis to protect the rights of all people with disabilities. Before the pandemic, we saw more often than not, individuals with disabilities would request accommodations from their employer, and they would be denied these accommodations. And we have parents fighting for IEP meetings and fighting for services in schools. We experienced the inability for individuals living at home and receiving services at home to have access to regular, consistent home health care services. Prior to the pandemic, time and time again, we saw how the system was failing the disability community.
My name is Maggie, and I live in Kenai, Alaska. I'm 38, almost 39, and I'm a mom, and I have a disability, a pretty significant one. Thinking about working in an office 9 to 5, 5 days a week, that is a pretty big barrier. It's very uncomfortable. My body is so sensitive to cold. There's a lot of pain. May of 2019, I was working part-time when I learned about a full-time position with nearly double the pay. I applied for it. The position was intended to be in office. So within my first interview, I said that I would require an accommodation. The position would need to be remote.
Prior to the pandemic, employers were quite rigid in how they viewed the workplace and the accommodations and reasonable requests that they would grant to employees. A reasonable accommodation is not a special privilege. It allows a person with a disability to successfully perform their work, and it's the law.
The whole process took almost a year, and I had given up on it several times. I finally got the job and was told that I might have been the first state employee to be hired completely for telework. I hate the word special attached to anything having to do with accommodation, because no, it's not special privilege, it's not special treatment. It's just me being able to do the same job that anybody else can, but in a different way.
Diego is a 16-year-old who is a freshman in high school. He also has some disabilities. He has cerebral palsy, a severe form of epilepsy, and he has a lot of respiratory issues. We do a lot of multitasking here, catching up on all the late night shows. We eat at the same time. We'll do medicine. Diego has a whole respiratory regimen that he follows. But he is a kid who wants to be out there in the middle of everything. He wants to participate and he wants to be included. And I look at it as our role to then find the ways to open those doors for him.
My name is JJ Rico. I'm the CEO for the Arizona Center for Disability Law, a protection and advocacy agency in Arizona, and also known as Diego's dad. So IEP is an individualized education program. An easy way to think about it is a contract between the school and the child saying these are the services we're going to provide you, hours of therapy you're entitled to. The IDEA, which is the Individuals with Disabilities Education Act, It's a federal law which spells out that a child with a disability is entitled to a free, appropriate public education. Historically, that wasn't always the case, so a law like this was needed to make sure that children with disabilities also had access to the classroom. We have seen school districts prior to COVID. We're not always following the IEP. Our number one phone call is about special education. Families are not calling us to tell us the great news that schools are doing the appropriate thing. It's usually the challenges that a school has denied something. School oftentimes says they don't have the resources to provide, let's say a one-on-one aide or a speech therapist for an hour a week. And each parent has to advocate for their child to make sure that they have access to the classroom and all the services they need to hopefully one day graduate.
My name is J.J. Holmes. I'm from Longwood, Florida. I live with my mom and dad and my little sister and my 2 crazy dogs. I'm 19. I will be graduating in May.
In Florida, when you have a child with disabilities and they can't live independently, there's a waiver program, which means that they can continue living at home with help instead of going into an institution.
It's important for people to be able to live in the community instead of an institution because institutions are very segregating. The U.S. Supreme Court's Olmstead decision in 1999 found that states were now required to provide services to individuals with disabilities in home or home-like settings, which would mean that they were no longer forced to be in institutions. Home and community-based waivers are managed by the states, and the states determine the amount of funding that's allotted to those programs. If there's not enough funding for a waiver, then there is going to be a wait list.
We got on the wait list in 2007 and have been for 16 years.
Mom, when do you think I'll get off the wait list?
No idea.
In Florida, that wait list is over 22,000 people, and it grows every year. Individuals who are placed on the wait list have been found to be eligible for the waiver programs, but they're not able to be enrolled because there's no funding available to serve them. But even when you have services approved through the waiver, it's very hard to find home care workers to provide those services.
My name is Annette Diaz. I live in Pembroke Pines, Florida, with my daughter, Catherine. Catherine got on the waiver in 1999. She has 24-hour care thanks to this program through Medicaid waiver. I have to be able to trust the person that comes into the home because Catherine can't communicate anything to me. So I have to be able to know that once I walk out that door, that she's being taken care of the way she's supposed to be.
These are individuals who are coming to your home to provide very personal care to you or your family member.
You have to find people that are willing to take a salary cut to do the home health part, because when they come in to work through an agency, they don't get benefits. They're independent contractors. Pay rate has been the same for many years, so it's just impossible to find personnel.
For years and years, the disability community has been a second thought from a policy perspective, from a healthcare services perspective. And then the pandemic hit.
The World Health Organization today declared the coronavirus a global pandemic, citing the alarming levels of spread.
We expect to see the number of cases, the number of deaths, and the number of affected countries climb even higher.
COVID happens and everything's shut down. All of the kids were online, the teachers were online.
Which was kind of nice because everybody was doing the same thing. So we were in the same boat as everybody else. Right, Diego? Do you remember? We got on your classes on Google Classroom and we logged in, and Diego even had choir.
But it did start to get a little bit trickier because, especially with the therapies, it's difficult to have the same effect when you're trying to do that remotely.
There was a period where he got 0, I think, physical therapy. We decided we'll just do something outside of the school, but some families don't have that option. So students lost out on those services. The schools where they're getting the therapies and they're getting the support, and the schools are closed or the schools are risky environments, they have been closed off from access to that. When schools reopened in Arizona, there was a movement of some schools not requiring masks whatsoever, which obviously exposed kids who might be medically fragile. Statistics have shown people with disabilities are more susceptible and also experienced higher infection, death rates, etc. So parents are making that decision, exposure versus access to education.
Even before COVID, it was very difficult to find in-home providers. With the pandemic, we faced record shortages of nursing workers and home care providers. According to a study by Anchor Foundation, United Cerebral Palsy, as of fall 2021, 77% of providers were turning away new referrals, and 84% were delaying the launch of new programs and services due to lack of staffing.
It's very important to ensure that we're building a workforce that's welcoming for those that choose home health care as their career, right? And so you want them to have a living wage. You want them to have access to benefits. And you want them to be able to have a structure in place that protects them and provides them with the protections that they needed, especially during COVID.
Once the pandemic hit, we lost one of our nurses, Marie. She had been with us 19 years. I haven't been able to find a nurse to fill in her time slot.
A lot of families struggle with an immediate need to find care for family members who've been getting home care from agencies prior to the pandemic, who might no longer be able to access that service. Annette struggles, and she lost one of her nursing providers to COVID. She was expected to pick up the slack for those services that weren't there.
I work 4 nights a week, 4 16-hour shifts. Then I have the personal care assistant in the daytime. She's here only 8 hours, but she can't do everything for her either. So it's not even that I can hand her off and leave her with her. I have to do certain things like feed her.
Trying to sleep that's something that I don't remember the last time I did well.
Catherine needs somebody 24/7. I couldn't imagine her being in a facility where she didn't have somebody one-on-one for her.
We need to make sure that the states are fully funding our home and community-based waiver programs. A large number of our caregivers are aging and will no longer be able to provide care to their family members. And if those individuals can't access our HCBS waiver because of a lack of funding, then they will be placed in institutional care.
I'm almost 70, and I just can't imagine how many 70-year-olds are out there that's got to do the things that I do. We both have back issues, carpal tunnel. I was supposed to be getting a surgery on it, and I have to keep putting it off because the downtime is a minimum of a month. And who's going to care for my son in that month where I can't lift him?
Individuals with disabilities experience abuse and neglect in institutions. Additionally, during the COVID-19 pandemic, we saw that the COVID virus spread very rapidly once an institution had an outbreak. And those patients who were living in those facilities were isolated from their families and friends.
Most parents think about, well, if I died, I'll do this for my kids or that for my kids. We can't even think about it because what would happen is just so awful to think about.
So I finally started working completely from home February 24th of 2020. I'm starting to get in the groove of things, and then COVID hits and the world completely shut down. And suddenly, no one could go to the office and everyone was teleworking in one day.
During the COVID pandemic, 35% of employees without disabilities and 25% of employees with disabilities were able to work from home. It's ironic that people with disabilities have been asking for telework and flexible accommodations for a very long time. Suddenly, the pandemic hits, and now we're able to do so.
It's totally the amount of steps that I had to go through when they came up with a fix that worked for everybody right away in one day.
You know, as I think back on all of the difficulties that we've seen on a regular basis throughout our community, and then all of a sudden, a lot of these difficulties we were able to manage at the drop of a hat as soon as everything closed, only highlighted for me what I've always believed to be true is the political will has always been missing when it comes to ensuring equal access to services and accommodations for people with disabilities.
More than 3 years after the global pandemic that claimed nearly 7 million lives around the world. The U.S. will no longer provide many Americans with free COVID tests, treatments, vaccines at no cost.
The emergency part of this pandemic is coming to an end. For some people, this is going to seem very arbitrary and accelerated. There are people who are still vulnerable.
This year, Diego started high school, and we wanted to try to spend more time, right, Diego?
He started to return for a few hours, 2 to 3 hours at a time, about a half a day. And we still work in time for him to come home and rest after school. We expect that going forward for the foreseeable future that he will still be on sort of a limited schedule and not be going full time. And so we've tried to work with schools so that he can spend some time online. Did you learn a lot today?
Yes.
By opening accommodations and telework and more of a flexible schedule for everyone, you're able to include a lot of people that might have been traditionally left out of the workforce, bring them to the table, let them have a voice and a perspective.
If you want someone like me to be able to work for you, then you have to accommodate them. In my job now, I'm able to work from home for 3 to 4 hours in the morning and then be able to go into my office for a few hours later in the afternoon.
The reasonable accommodations that are offered to people with disabilities allow them to expand their career and have upward mobility and more opportunities.
I was able to go on vacation, buy myself new furniture, and do other things I'd never been able to do before.
Pre-COVID, we thought certain things weren't possible, but we were forced to do it. We've shown it can be done. So I do not think they can now sit here and deny that we can't provide learning in a remote way or in a hybrid way.
What we do see, even now, years later, is that some of these difficulties continue. We know now for a fact that we do not have enough home health care workers available. And so we need to invest in that. We need to build out this career path for individuals. We need to reduce the waiver wait list. It's imperative for individuals to be able to live at home and receive the services that Olmsted says that they are entitled to receive at home and not at a facility.
The thought of maybe having to live in a state-run institution keeps me up at night. It's becoming more likely because I don't know when I'll get off the wait list. I have very big ambitions. I want to become an advocate that fights for marginalized communities and maybe even run for office one day.
Individuals with disabilities have the right to live a full life in the community. The pandemic showed us that this is not a crisis that we can ignore any further.
The pandemic was a horrible thing for our community and we lost a lot of loved ones, but at the same time, it really tore open the fact that we can do this and we do have the right to have access to everything equally. We should never be a second thought.